Welcome back, guys. So today we're going to be talking about some really, really fun information. So just bear with us. No, we're going to dig into the Code of Ethics, and then we're just going to go through some HIPAA stuff. But particularly the HIPAA stuff is probably not something that we're all carrying around in our back pocket and know all the ins and outs of. So we just want to introduce you to it and just give you some important components that kind of tie into HIPAA, just so you have a better understanding of what it is and how it ties into health coaching, particularly if you are working in a setting where you are electronically filing any type of insurance claim. Even if it isn't related to health coaching, you're still bound to HIPAA. So we want to go through that. And we're going to go through the Code of Ethics because there are going to be several questions regarding the Code of Ethics. So we're going to start with the Code of Ethics and just kind of dig a little bit through it. We really recommend that you go to the website, print the Code of Ethics, and just be familiar with it. Know it.
Know it. Lots of questions.
There are a lot of questions, and it'll be situational questions, yet it'll be your job to figure out which part of the Code of Ethics this situation is either going against or kind of involved with. Okay, so what is the Code of Ethics? Basically, it's just guidelines and standards that are going to ensure we are doing what we are supposed to be doing. So some of the heavy hitters that fall within the Code of Ethics are professional development, walking the talk. It really is our job to kind of be that role model. We talked about in theories that the role model is impactful. And so when we are walking the talk, doing those things, it can be very helpful to our clients. What falls within the scope of practice, and it does touch on some guidelines regarding dual professions. So if we have the dietitian who's the health coach, or we have the, whatever it may be, what it looks like when we have several hats that we wear. So these are just the definitions. So when you are going through the Code of Ethics, this is just a definition of what each of those titles mean. So the coach is actually the coach. The professional coaching relationship. This is when an agreement is in place, that written contract that is specifying the roles and responsibilities for both parties.
And the reason we have written in parentheses is you don't have to have it in writing, but you definitely need to cover it.
Yes, exactly. And it's helpful to have it in writing.
I like having it in writing.
When you have it in writing, then you have it in writing. So we definitely recommend go ahead and make it official.
Yes.
So roles within the relationship, the client is the person being coached. Now, sponsor you may see if you are particularly like in a corporate setting where you are providing services for employees, then the employee isn't necessarily going to be paying for that service. That's when you're going to see the terminology around sponsor. That's the person that is covering the services. Faculty would be, anyone who's providing instruction, training. Mentor is going to be the person who is, if you're in a coaching session, you have somebody observing, that's going to be the mentor. And then student obviously involves someone who is actively enrolled in a program who may be offering coaching services under that student title. Okay, so scope of practice. What falls within here? Getting to know the client, that would be your intake form, your wellness assessment, those types of things. You really want to clearly define your credentials because, again, we don't ever want to be falling outside of our scope of practice.
Yes.
And this is important. And we've talked about this from day one. We don't want to start falling into therapy. We don't want to start falling into what would be a dietitian's role, particularly depending on the state that you're in and what are your laws around some of those things that, you can and can't say within a coaching session. So you really want to be familiar with that. We don't ever want to play the expert role, really, if the health coaching hat is on, period. However, we only want to do that in the role that we are certified to do so. Right. And that's, again, important to note. And it's, there several, our hope is like all nurses have this certification.
Right.
It's wonderful that we wear these dual hats. We just want to make sure that we're always working under the hat that we're wearing at that time. And we can also, if applicable, act if there's a type of therapy kind of working together in certain situations. Okay, when to refer. This is a big one because it is important to know when to refer, because we may have those clients that need to be referred.
Yes.
And again, we've talked about this in several of our lectures, but it really is critical to recognize this. So listed below, and I won't read all of these, but these are just some of those common symptoms that you may see when we start falling into, okay, this looks like a mental health specialist needs to step in and do this. And, that's just increased sadness, unable to concentrate, focus, poor sleep, change in appetite, risky behavior, certainly suicidal thoughts. There may be some less obvious signals that are out there, if you're seeing that there is just kind of these patterns that are showing up, whether that be self-defeating behaviors or for whatever reason, they're just kind of holding themselves back.
Right. And I think I'd add that the main thing that this list and any other potential less obvious client conversations that you may have, it's important that you realize this is all about the client, remember, and that if you notice things, it's your duty to discuss them with your client and refer out.
Absolutely. Absolutely. Because again, at that point where we have that rapport,
yes,
it really isn't a difficult conversation to have either. They trust you.
Yes.
They trust your concerns. They trust and it's okay for us to name it. Of like, hey, I'm noticing this pattern. And generally when it comes from us, it's a fairly easy referral to make at that point. Okay, professional conduct. So when you look at the Code of Ethics, there's all these different sections, okay, and titles within the sections. You need to know these, and you need to know the sections, and you need to know what falls under each section. So we're just kind of pinpointing on some of these sections, but again, go to the Code of Ethics and really read through it and really understand it before you take the exam.
Yes, and there's two particular things that I would mention. That there's professional conduct at large and professional conduct with clients. And we're doing a general professional conduct, but there are questions that relate to those individually where you identify, is this professional conduct at large or is it professional conduct with clients? And it's clearly stated on when you pull down the Code of Ethics. And so the best way to really get these really in your head is to look at it and read and distinguish the difference, because they're very similar.
They're very similar. And this was confusing because when I took the exam, I was like, oh, I knew it was professional conduct. I was like, and the options are, professional conduct at large, professional conduct with client, scope of practice, it'll be all the options within there. And I'm like, oh my gosh. So just know what falls under each category, because they are going to ask you that.
Yes.
So pay attention to that. But some of the key concepts that are going to fall under that professional conduct is, we really do want to hold ourselves to the same standards as all other healthcare professionals. What we do matters, and we really do want to be professional about that. We need to be open to professional development. And we talked about that before in our earlier slides. It really is our obligation to stay on top of the research, to stay on top of the trends, and to make sure that we are continuously checking in and getting the education that we need so that we know we are serving our clients the best that we can. And then don't be afraid to reach out. Ask for, talk to your peers, talk to your mentors. If there's an area that's like, oh gosh, that's frequent with health coaches that I know, hey, this came up And, what are your thoughts around this? And certainly we do it in a confidential manner. However, if you need supervision or if you need just to kind of chat with someone, don't be afraid to do that. I mean, that really is our obligation to do that. So walking the talk. We really are serving as a role model. I mean, they are coming to us, so it can be really important to kind of, do the things and really do that. And that ties into our health, both physical and emotional. So, we talked in some of our earlier slides about that self-monitoring. So we really do want to be able to continuously check in with ourselves and, hey, how am I doing? Where do I stand with my wellness assessment?
Right.
What does this look like? And, again, we're always continuing to grow, and there's always room to grow. And so it is important for us to really do that. And, effective coach-client relationship depends more on, it's not just the coaching skills. It's about the connections. It's about the things that we do. And when our clients see that we are in a similar space and that we are taking our wellness assessment seriously, then that matters. So let's talk a little bit about self-care. Here's just a simple definition of self-care: a way of living that incorporates behaviors that enable one to maintain personal health, balance, replenish energy and motivation, and grow as a person. And that is actually from our coaching psychology manual. And really, the key to helping others is burnout is big. And so not only do we need to be taking care of ourselves, but we really need to be having discussions around self-care with our clients. Yes. Because most of the time, coaches come from that wanting to help mindset.
Yes.
And we know that the helping professions, the burnout rate is one of the highest. And so we're all kind of already at risk. So we want to be checking in with ourselves, and we really want to be checking in with our clients. And, yes. What does your self-care look like? What are we doing? So again, we want to monitor our behavior and, be aware of some of our triggers, set some self-boundaries if need be. And, the more we're checking in with ourselves, again, the better we're going to be at.
And I think the triggers are extremely important. You need to know your own triggers.
Yes,
and if something comes up in a session, after the session, you need to really take a minute and think about that. What was the trigger, and were you able to maneuver it well?
Right, exactly, exactly. Self-reflection is huge. Kind of filling out that rubric. The rubric that we have here in class is so helpful. It's just, I will take time to kind of reflect back through all of those things and, okay, what did I do? Yeah. And that's part of my notes, like, what could I do better? And at the very bottom of my notes, I always put kind of those, could have checked in here, or just like the things that I've noticed. I kind of end my notes with that little part after each session, and that can be really helpful. Okay, assessment of skills. It can be helpful to develop a professional development plan, kind of similar to goal setting of like, hey, where am I with my reflection skills? Where am I with my, whatever that looks like, to just, again, continuously check in and make sure, where would it make sense for me to have some professional development? Just kind of me knowing what I know about where I am right now. And again, we just talked about this, reflect after each session. Ask yourself questions. What am I learning about myself? What are my strengths? What are my weaknesses? Am I modeling wellness? That's a big one, walking the talk, doing the things that we say we're doing. And then there's some example questions that fall in this in your coaching psychology manual. So if you kind of want to look at some of that self-reflection, you can find that in there. Create a rubric. Again, like, you can even use the rubric we use here in class. Right. You may find one that meshes better, or there's areas you always want to kind of reflect back on. Is just kind of make a rubric yourself and always have that there so you can kind of flip back and say, hey, how am I doing? Stay up to date with current research, and make sure that you are following the CEs and where we're supposed to be with that. Right now you are reaccredited every 3 years. So just make sure that you're always following NBHWC and where they want us to be with our continuing education. Okay, When to refer. Now, the way that these slides are written out, when you see that code of ethics underneath, this is how it's written in the code of ethics. So this is just straight from the code of ethics, okay? So we just have some slides that have the actual code of ethics in there, just so you'll be familiar with it. So the portion of when to refer is, strive to protect health, safety, and welfare of our clients, encourage change if believe client or sponsor would be better served by another coach. This is a big one. We're not always going to mesh.
That's right.
And it's okay. It's okay to say, hey, I've got a coach that I think you guys are really going to do well together. And this may be a better fit for you. So it's okay. You see that sometimes. And it can be very helpful when we have our little Rolodex of other professionals to refer to. I have my personal trainer, I have my dietitian, I have, some of the physicians around town. I mean, that's the beauty of where we are, is we're small enough that we kind of know all the physicians. So I have my little Rolodex, and we all do, of, kind of our go-tos when certain things come up, so that we do have easy referrals for our clients when they ask for them. Okay, so within code of the scope of practice part of this professional conduct, you want to accurately identify coaching qualifications, expertise, training, and we want to adhere to all ethical standards respective to our license and credentials. So that's a big one, always understanding, we got to stay in our lane.
Yes,
basically.
And that is stressed on the exam.
Yes.
They'll give you a scenario and you'll have to decide, is this person practicing outside of their credentials?
Right. Have they strayed? They in the other lane. We got to get them back in.
Yeah. Absolutely.
Okay. Recognize and honor efforts and contributions of others. Again, these are the different sections that are listed. Only claim ownership of your own material, and violation may lead to legal remedy by a third party. So if we are using the work of others, if we are, that's kind of what's falling under this, basically giving credit where credit is due. And that is our obligation to always do that.
And this is professional conduct at large, just so you know.
Perfect. Okay. Okay, so these are just some general, and I don't even need to read all of this. You guys just go and read the code of ethics. We want to communicate to everybody, commit to the need of continuing professional skill development, strive to recognize personal issues that may impair coaching. Again, this is where that self-check-in comes in.
Right.
Maybe even we've had just a major life curveball and we just have to end coaching altogether. It may even go beyond, hey, I've had a rough day and we're going to need to reschedule. Maybe we just need to hit pause for a minute. So continuously checking in to make sure that we are in a state that makes sense for us to actually be that mentor, to be that coach, so that we can be present for our clients. We definitely want to, if we notice that there is a breach of code, pay attention to that. It is our obligation to report that and to kind of understand what is the chain of command there, and who you need to report to. And that may depend on the setting, but it is our obligation to report to NBHWC. So if you know of something that is happening within a breach, then it's our obligation to report that. And conduct research with competence, honesty, and within guidelines. A lot of the code of ethics we hope is common sense.
Yes.
However, it doesn't hurt to go over it. So again, this is just some more stuff within the professional conduct, and these are just more of the general statements to pay attention to. So you guys can read through all of that. Basically, we're going to be truthful when we communicate. We do want to have a clear coaching agreement before beginning the relationship, and we want to honor that. If we're taking the time to make this contract, it's our obligation to honor the contract.
Right.
And so we want to make sure that we're doing that. And you really want everything to fall in that agreement. The roles, responsibilities. kind of anything that's going to be happening, we got to get in that contract. That way we're covered.
Right.
And a client does have the right to terminate at any time. And I know in my contract, I have that in there. Hey, if any time you want to terminate, that is perfectly fine. And you can write it up how you want to, as far as, you're going to pay this. And if you terminate, you still have to pay what you committed to. But they do have the right to no longer participate if that's how they feel. Okay, maintaining professional boundaries. Again, these are just statements within the code of ethics. We want to avoid romantic relationships, common sense, right?
Yeah.
We want to be alert to sexual intimacy, including support staff. So if you are seeing something, again, it's our duty to report. And we want to make sure that we are being treated with respect, and that needs to be reported as well. And so take the appropriate actions to address an issue. Even if you're just in private practice and it just comes to canceling the engagement, you have the right to do that. And certainly if you are in a medical setting or another setting, you are trained on this, and you take your little quizzes that you have to take every year on what are the steps, who do I go to, who's my contact point. So you really kind of know, okay, what do I do when there is a breach in this area? Okay, confidentiality. The number one important, in my opinion, piece of the code of ethics. Again, this is the foundation of our coaching relationship, is that confidentiality. And we really want to make sure that we have clearly established that confidentiality, both written and oral. In session 1, this is a big part of what we talk about, and it is in that contract. So they are going to hear confidentiality over and over again because it is that important. This is where you're going to need to be familiar with HIPAA. Because again, if you are an entity that is electronically filing claims, you legally are bound to follow HIPAA. Now, as a health coach who is potentially not with that type of agency, it is still our obligation to comply with HIPAA. That's really the recommendation. Even though there isn't a law that says you have to comply, it's really our obligation to really follow those HIPAA rules, which is why we're going to take a big part of today to kind of go through some of that. And you will have to, wherever you are, obviously you're going to follow what those obligations are.
Right.
Okay, so coaches' expectations. Strict level of confidentiality with all clients. Establish a clear agreement about how information will be exchanged. So again, when we are in session 1 and maybe we're, if you are open to sharing notes with your general physician or your dietitian or your personal trainer, we always want to get that in writing so that we have a clear agreement of what that's going to look like, how that's going to happen, if that is even something they agree to. And a clear agreement about what conditions in which confidentiality may not be maintained. And that would be our spiel about if you,
harm to yourself or others.
Right.
Yeah.
Right, exactly. And we always want to make sure that's clear too.
Yes.
And it is our obligation to require that all other working coaches adhere to. And that's a big, I feel like there was a question, I know in our study guide questions, those are questions of like, oh, you're meeting with a coach and they say, blah, 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 blah. What do you do next? And if they are giving you names and personal information about a specific client, that is a breach. That is a breach of confidentiality. So we have to be very careful when we are seeking maybe some consultations around people or, reaching out to mentors. We always have to do it in a confidential manner.
Yes.
So this is just the way that some of them are written in the code of ethics. Maintain, store, and dispose of any records within the compliance of the laws that are applicable to us. So again, it's just best practice to follow HIPAA on that. And what are your state laws about how long records need to be maintained, all of that good stuff. You want to use your credentialed coach contact information only in a manner and to the extent authorized by NBHWC. So if you have coaches that you're maybe referring to, you don't want to just be passing out personal phone numbers.
Right.
You know, you want to make sure that you know, hey, what do they have in their profile? What is their preferred means of contact when you are referring a client to them? Okay, conflict of interest. This is basically a situation in which a coach has a private or personal interest which may influence the objective of their professional role or responsibility as a coach, faculty, or mentor. That's a lot of words to talk about a conflict of interest. So within conflict of interest, these are some of the things that are going to fall underneath that. So we want to avoid potential conflicts. We want to openly disclose the conflict.
Yes.
Remove yourself from coaching if that arises. And there's a lot of situations in which this may be, something that creeps in. You want to clearly clarify your role. You want to set the appropriate boundaries and review conflicts of interest that may arise. Disclose that with the client, particularly if you're working for a specific company. If you're working, I don't know, what would be an example? Like if Slim Fast hired you.
Right.
Slim Fast put coaches on, and so you're recommending Slim Fast, you have to disclose that.
If you're getting compensation of any kind,
yes,
you want to make sure that you tell your client up front that you are getting an additional compensation for referring this product.
Right, which is kind of that third dot there. All third-party compensations, you have to disclose that. If you are someone and you had like supplements in your office,
exactly,
and you got a commission off of that supplement, you have to disclose that in the beginning, not after the purchase, not at the time of the purchase, but before anything goes down. You need to disclose any type of compensation that you're going to get from anything that may go down in that coaching session. And if you are someone who sells this and they don't want to buy the things, you can't just say, oh, well, I'm not going to coach you.
No.
If you had someone that was like, well, I don't really want to use the Slim Fast, well, it's our obligation to be their coach. And so we can't just say, oh, well, I'm sorry, you're not a good fit for us. We really need to follow through with that. Okay, cultural sensitivity. And we're going to talk more about this when we dig into our DEIA day. But basically, this is minorities, our ethnicity, socioeconomic status, gender, race, disability, age, our sexual gender orientation, appearance. I mean, it can be anything that falls within this. And it is our job to be respectful of every single person who walks through our door. And so it really does require more than just good intentions, right?
Yes, you need to make sure that you are checking yourself. Again, do you automatically see someone from a different background and you start making assumptions? As a coach, we don't do that, and we check ourselves, and we're very, very concerned about any bias we may have.
Yeah, absolutely. And it is our obligation to check in with ourselves.
And check in with a mentor you have. If you're even remotely questioning whether you're doing that.
Right.
Yep.
What are our, unconscious biases?
Right.
We all have them. And so it's our responsibility to really kind of uncover that. And there's actually some tests out there that you can take that'll, give you some food for thought of what that is. And, be honest with yourself about, okay, what are my personal beliefs? Right. What are maybe my triggers?
Right.
What do I need to check in with myself to ensure that I am being sensitive to this person, their needs, their beliefs? Again, we are never coaching from our beliefs. We are always with that client. And so it really is up to us that, educate ourselves. If we have
Yes.
someone from a culture that we're not familiar with, learn about it. So that we do have an understanding and appreciation for where they are coming from.
I particularly think the last bullet is super important. What is the language of inclusion?
Right.
And that's a good question to ask yourself
Right.
constantly when you are getting ready to sit down with a client, particularly a client that maybe you don't know as well or comes from a different background. So you can just ask yourself, what are some things I can make sure I use, words that I can use to
Right.
promote inclusion?
And ask them.
Yeah.
It's okay. And
Yeah.
I think that's on the next slide. I think there's a slide in here on that. It's okay. It's not okay to assume. It's always okay to inquire.
Yes, that's a great way to put it.
Yeah. It's like, okay, I'd love to learn more about your culture and
Right.
how do you communicate? We have some cultures that eye contact is actually, frowned upon. And so, here eye contact means everything,
Right.
and so it really is, it's okay to ask. People love to share about their cultures, their beliefs. And so it really is up to us to take that next step and say, hey, I'd really like to learn more about this. We want to avoid othering thoughts. And again, this can kind of creep in as that unconscious bias of like, oh, well, that's how they do it. Or, oh, that is, it's kind of this us versus them picture where there's this, differentiation of kind of whatever it is that's in front of us. And this really can reinforce stereotypes. So we want to kind of catch ourselves if we have those othering thoughts creeping in. And so like an example might be you see someone for the first time and you think, oh no, what am I going to do with this client?
Right.
Like, oh gosh, or this is going to be really challenging. And so we kind of have to catch ourselves in some of those thoughts. So the best rule of thumb is to ask.
Yeah.
Ask politely, ask sincerely. We truly want to learn, and we definitely don't want to make assumptions because, again, in some of our othering thoughts, they might be wrong. Like, oh, well, this is how this culture works. We don't know that. We don't know that until we ask and we get to know that person in front of us. So these are just the bullet points in the Code of Ethics around cultural sensitivity. Refrain from unlawful discrimination in occupations, activities, demonstrate dignity and respect. We want to be setting clear, appropriate, cultural sensitive boundaries that govern interactions, physical or otherwise. Okay. Do you have anything else you want to add to the Code of Ethics?
I just really think go download the actual Code of Ethics and remember the way I did it is I literally, there's like 3 sections: professional conduct at large, conflict of interest, and professional conduct with clients. And I outlined those so I was clear what scenario would fall under each one. And I think you'll be fine. That, and every time we have a slide that says Code of Ethics, it's the language that's in there.
Yeah, so when you see that Code of Ethics underneath, that's the actual bullet point that comes into play. And again, it's all going to be situational, the way that they ask. So you'll have this long story of Sally owns a supplement company, and she is meeting with Joan, and Joan decides that she doesn't want to purchase her supplements. Sally says blah, 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 and then you kind of choose, whatever would be the best answer underneath that. So they're all going to be situational again.
Yes.
And sometimes it'll be this long situation and it'll say, Sally is outside of, or whatever, and then you have to choose, is she...
Scope of practice.
Is it scope of practice? Is it professional conduct at large, professional conduct with client, or confidentiality? Or whatever. It'll give you 4 things. You have to pick which one this scenario would fall under which is the part where you really need to know each of those sections.
Yes.
Yes. Okay.
And the most fun.
Now.
We're actually fortunate, though, that Beth, being an audiologist by trade, has had to deal with and knows a lot about HIPAA.
Well, it's not, the papers that come with HIPAA are about
Yeah, that's
this
what
thick.
I mean.
So we're just going to like go over like
Yeah.
a little bit of kind of the legal components that come with HIPAA.
Yes.
Okay. And again, it's not a ton. You know, what they tell you to study is they literally give you the reference to the thing.
Yes.
And so you don't have to know the thing. We just kind of have to know and understand a little bit about HIPAA. And I have put a little bit more in here than what you will actually be tested on, just because it can be a little bit easier to wrap your brain around these things with HIPAA if you just have a little bit more of an understanding of the method to the madness and what means what and what title means what. So it can just make it a little bit easier to follow, particularly if you're not from the medical world. HIPAA can be a little bit of a foreign topic, other than we all know we sign that HIPAA rights paper every time we go to the physician, like 5 times.
Yes.
So we're just going to dig a little bit through HIPAA. Okay. As far as like really anything legal, your laws are going to vary by state. Know your laws, okay? Know what you can and can't do. So you always want to consider the credentials held. You know, are you audiologist / health coach? And you can always work within those. But know your laws. You know, we've talked about in class before, you know, nutrition plans. So here in North Carolina, we are not allowed to give any guidance of any type of nutrition plan. That can only be carried out through a dietitian. So we can offer resources through those public entities, your, you know, MyPlates and your CDCs and your NIHs. However, we cannot say, oh, you're diabetic, let me give you this low sugar diabetic diet plan. We have to stick with very general. Now, some states are looser than others, and we happen to be in one of the stricter states. So know your state laws.
Yep.
As a health coach, we're never going to tell them exactly how to eat anyway, right? However, know your laws. So that's just kind of a general legal blanket statement there to begin with. Okay, so important numbers to know as you become a health coach. Now, this is, again, some really dry information. I just wanted to put this in because this is language that you are going to be hearing as we move closer and closer to having billable services.
Okay, I was just thinking, this is not the boring information, because what that means is when we become knowledgeable, because we have to more on these codes and what they mean, that means insurance.
Yes,
is going to be.
We're at least talking about it.
Yeah, so we're talking about it now and getting you familiar with the fact that we hope, and the National Board hopes, that one day insurance will cover certified health coaching.
Yes.
And that's exciting.
It is exciting. Fingers crossed. We're
close.
We're getting there. We'll say that. And when you go, I think, because I know when we were taking the exam, this wasn't even a thing. I think now they're talking a little bit about this in their Q&As of where they stand and what's going on. So again, when you kind of start hearing them talk about taxonomy codes and NPIs and EINs, that this is just going to at least give you an idea of what in the world they're talking about. So let's just go through a little bit of it. So what a taxonomy code is this is a code that every profession has been given. So as an audiologist, I have a taxonomy code that coincides with audiology, so that when something is billed, it's billed under that taxonomy code, so they know that the audiologist is the medical provider involved in that service, okay? So we, as health coaches, were granted a taxonomy code back in 2021, which is a huge first step, because you have to have a taxonomy code to be able to send that bill in. So again, we're making progress. So when you hear them talking about a taxonomy code, that's what that means, is that it's just this number that is tagged to health coaching, okay? Now then you have your national provider number. This is going to be a unique personal identifier number that stays with you your entire career. So as an audiologist, I have an MPI. So when I bill, I'm billing under that MPI number. And again, it depends on the setting that you're in as to what you're billing under, because there's a national employer identifier, which is also billed to your entity. So when I worked for Baptist has a number. So sometimes actually my services are billed under Baptist, not necessarily my MPI. So it's all a bunch of things, and you have to be in insurance to even understand it all. It's super confusing. However, these are really important numbers. So we just wanted you to be familiar with them, to know at some point I don't know if we will have to have an MPI. It depends on how you're billing. It may be that it's always billed under their EIN. That's an insurance person question. However, depending on how you're billing and what that looks like, these are the numbers that may or may not come into play. So just wanted to kind of put that in front of you. If you want to read about the health coaching taxonomy code and kind of what went into that, this is the link that'll get you there. And this is just straight from MBHWC. So you can learn more about that. Okay, coding. You've got your CPT codes, and then you've got your ICD-10 codes, okay? Your CPT code is the service that you did, okay? This is where we are in the process of, hey, what's happening? What have we done, okay? So there are currently 3 codes that are under, I don't even know what you call it, that they're investigating to see whether health coaching is worthy enough to be granted a code, basically. So we're category 3 right now, which is basically means it's a temporary code. End goal is to get to category 1. And I'm not sure, but I think you just go from category 3 to category 1. Our end goal is category 1. And so once it's category 1, we can be regularly reimbursed. That is a code that is now in the system that we can bill for, and insurance companies will reimburse us for that. So that's where we are at this point, is kind of working towards that category 1. The ICD-10 is the actual diagnosis that comes with that. So you're going to have what you did, and then you're going to have what the diagnosis is. As far as coaching, I don't know what that's going to look like, what that pairing is, but those are kind of the 2 players when it comes to filing insurance. Okay, let's talk confidentiality, which is what's going to loop us back to HIPAA. Basically, it's a protection of client records. We all have the right to have privacy when we are in a medical setting. We really should have a general knowledge of HIPAA. I mean, at least a very basic knowledge of what it is. And we must follow the confidentiality regulations based on the setting that we're in. So again, if we were health coaching through a hospital, then we are going to follow all of the HIPAA regulations that come within that hospital. Okay. This is the link that'll get you to all things HIPAA if you would like to go and read all of the things.
I'd like to add, what does HIPAA stand for? It's important you know that. That was on my exam.
Oh, yeah, and it was on my exam.
Yeah, because we say HIPAA, but what does it actually stand for? What's the acronym?
Yes, and so know that. It's the title right here.
Yes.
Health Insurance Portability Accountability Act.
Yes.
And it'll give you like HIPPA, HIAPA, you know, it'll give you all the things, and you have to know which one it is, or you have to choose Health Insurance Portability Accountability Act when it says what is HIPAA.
Yes.
And I think that's actually one that is not even a scenario.
No, I think
they just point blank ask you.
Yeah, they want you to know this. So
yes, so know this. So there's basically 2 components of HIPAA. You've got your privacy rule and you've got your security rule, okay? Know those 2 rules, okay? You don't know everything that falls within them because the security rule is crazy long. Just know that there are 2 major components in this. So let's talk a little bit about the privacy rule. These were standards developed to protect our medical rights, that we have the right to have our information held secure. So it requires safeguards to be put into place to protect our personal health information. So you will see really everywhere in the medical world PHI, and that stands for personal health information. That's a pretty common acronym that's out there. It sets limits on the usage and disclosure of our PHI. So again, that comes into that written agreement of, hey, I can share what we talk about with your mental health specialist. That is, we always want to have limits and things in place disclosing where that PHI is going to go and who it's going to go to and how it's going to get to them.
Exactly.
So personal health information can be used for treatment, payment, or other functions, but must remain confidential. And so the payment piece comes into when you're submitting billing, you have that diagnosis.
Right.
You've got to have that ICD code tagged to it. And so they do allow paying entities to have access to some of that just because that's the nature of how you get reimbursed. It covers everything, whether it's submitted in an email, whether it's paper, whether it's oral. This HIPAA covers all of it. And it also has a section that gives patients the right to their health information, which seems weird because it's our health information. I should have access to it. And they really did want to make a point to say, hey, if you are providing care, that patient has a right. They have a right to their chart. They have a right to go in and examine the chart. They have a right to request correction. So if they read a chart note and they feel like that is not what was discussed or there's something that needs to be changed, then you as a patient have the right to go in and request that get corrected. And that all falls under the privacy rule. So what is PHI? It's a lot, as you can see right here. And this is a test question too. So be familiar what's considered personal protected health information, okay? It's going to be your name, address, your birthday, phone numbers, fax numbers, emails. I mean, honestly, anything that can be connected, it really kind of all falls under here. Account numbers are big. We all have a patient number.
Right.
That's considered PHI. License numbers, your driver's license, serial numbers. This was big in audiology. Every hearing aid has a serial number.
Okay.
So we can't just be like spitting out serial numbers. I mean, that's protected information. So again, you can read through some of these, but any biometric information, photographs. If we have a photograph, there's a lot of places now where they take your picture to put with your chart.
Yes, they do.
All of that's protected. So really anything that is connected to that patient is going to be protected. Okay, security rule. Security rule is specific to electronic information. Okay, so that's the big difference. Security rule came into play when we started bringing computers into our life. So HIPAA was kind of there, and then we've got this electronic component, okay? So if you are a covered entity, you are going to be required to implement physical, technical, and administrative safeguards in place. So the rules are, though, designed to be flexible and scalable because depending on the setting you're in, may depend on what type of roadblocks you can even put into play as far as getting into those charts and that sort of thing. So what are some of the safeguards? Administrative. This is basically the way your practice is set up. So you're reducing the risk of a breach just in even the way that the design of your office. Your policies and procedures. What are your policies and procedures, and how are they designed to keep your information safe? Maybe even a security officer in place if applicable. And this is where your training and accountability is going to come into place. So if you're working in a major hospital, you have to take HIPAA training every year. So this is all kind of falling in that administrative piece. The technical piece is going to be, around actually the hardware and the things, So how are you controlling access to your software? Do you have a password protected computer? What type of passwords are involved? Is it a two-step authentication that's in place? All of that stuff that's kind of falling in there. Are you using a system that doesn't allow permanent deletion of notes? And again, this is a little more specific. You don't have to know this for the exam. However, if you're using if you're keeping your notes on Word, Excel, Google Docs, you are technically not HIPAA compliant.
Right.
Because if you're using a true EMR, which is an electronic medical record, is what that stands for, those can never truly be deleted. So you've always got access to them. So just kind of, if you're just private on your own, you're not going to go buy and these EMR systems are hundreds and hundreds, thousands of dollars. You're not going to go out and buy that. Just be aware if you're technically under HIPAA, those do not fall as accepted means of tracking patient data. Okay, physical. This is limiting the physical access to your desktops, your phones, your iPads, and all of that stuff. Where are you keeping them? Are you driving around with them in the back of your car?
Right.
That sort of thing. What's the physical boundary that is within getting to that computer? So, this is, what is your workstation? What is the device security? And so you want to look at who has access to that hardware, who can get in. Where is the hardware located in the office? We don't have our computers laying around in the waiting room. We generally have them behind a desk in an office that patients don't have, the ability to get into.
But I think now in today's world, the fact we have our phone everywhere we go, and on your phone may come the access to records. And you need to make sure you're safeguarding that.
Absolutely. So if you are using Google Docs, having that password protected, that just your own account.
Two-factor at a minimum.
Yeah, exactly. Exactly. And if you're in a medical setting, you have to use their device and you have to download the thing that gives you the code every time you open it to get in, all the things. Okay, so who must comply with HIPAA? Now these are the folks that are legally bound to comply with HIPAA. And they're called covered entities. So again, this is just some of the language around HIPAA. It won't be this detailed on your test. It's just important information to understand moving forward, just so that you have a better grasp of how to navigate HIPAA and what that looks like. So here are your covered entities, okay? You've got your healthcare providers. So this is gonna be you. This is gonna be the person who is doing the work and who is electronically transmitting health information. So here's the big word, electronically.
Right.
So if you are submitting billing electronically to Blue Cross Blue Shield or to whoever, you fall under HIPAA. So if you are just in a private practice on your own and you're not electronically transmitting any type of health information regarding their diagnosis and payment, you technically aren't a covered entity.
Right.
You're not following under that. We just want to take the steps to get ourselves as HIPAA compliant as we can to just be good Samaritans of our clients' data.
But you are still, it's not HIPAA, you're not a healthcare provider at that point, but you are still bound by the Code of Ethics.
Yes.
And you're bound by confidentiality. And
absolutely.
So I think that's why we stress HIPAA, because if you go to that next level, then you're covering everything.
You're always compliant.
Yes, you're compliant.
Always compliant. Okay, your healthcare clearinghouses. These are going to be your billing services, your companies, your community health management information systems. Okay, so these are kind of the middleman that's going on with this. So again, in private practice, you're probably not going to be involved in clearinghouses. But these are going to be the people that are, paying the bills.
Right.
that have the information because they are the ones administering the payment. And then your health plan is just the plan that's in place. So this is what sets the schedule of what you're going to get paid, how you're going to get paid, all of that stuff.
Yep.
Okay, so what are some examples of health plans? This is like your Medicare, your Medicaid, any type of medical, your Blue Cross Blue Shield, your dental plans, any pharmaceutical plans, or an employer plan. And so that would be like, you know, if you are doing some corporate coaching,
Right.
that employer could technically fall underneath that health plan. Again, if you're just working for a manufacturing company, they're not electronically filing anything. So that's
Right.
not technically going to be a covered entity. However, you know, if you are working at Baptist and they are offering coaching to, you know, every diabetic patient, that would fall underneath that. There are exceptions to the employers. If you have less than 50 participants, then you're not technically a covered entity. Government programs that do not provide direct payment, so like food stamps, those types of services don't fall under this. Community health centers who provide direct care, they don't technically fall under this. Workers' compensation, insurance, that sort of thing doesn't fall under covered entity as well. So again, you don't need to be this specific in your knowledge. This is just kind of giving you a better idea of what falls under all of this and what the language is around HIPAA and all that good stuff. So what are some other legal considerations? Medical referrals. It is our duty to communicate effectively if concerns arise. We've talked about that over and over again. Now, if a client does not follow through with that referral, it's recommended that you discontinue coaching. If you feel that it's the point where, you know, this person really should seek help out, then it may come to the point of us discontinuing.
Right.
And that's okay to do that. It's helpful to build relationships. You know, we actually talked about this, our Rolodex of referrals to, you know, of who we want to go based on kind of what lands in our lap and what resources they're seeking from us. If you are communicating with, so if you have a physician who you're communicating with, then they are bound by HIPAA, which means we are following HIPAA at that point because they are bound by HIPAA. Okay, so these are just some general legal recommendations that you can follow. Number one, it's okay to talk to an attorney. When you're putting your contract together, have an attorney take a look at that. Know your laws, know your state laws around health coaching, around nutrition, around, you know, personal training, all the things that may come up, because it's going to look different state to state, and you want to make sure that you are within compliance in your state. Provide a clear disclaimer. Again, get your contract in check. Have that attorney recheck your contract. And purchase liability insurance. This is big. There's a bunch out there. And I get this question a lot. Who's your insurance through? What do you know, how have you gotten your insurance? There are online insurance coverage out there. My insurance is through my personal, you know, we're just here in old Ashburn, North Carolina, so we know everybody. So my personal insurance agent who does my car, my house, I have a liability plan set up through them just because I have a relationship with them. And so I have reached my local agent for that type of coverage. However, there is coverage out there. I think Ray said she got hers from somewhere that was in a different state, maybe.
More specific to health coaching, maybe?
Right. I don't know. But there's any type of liability insurance. And I just sat down with my person and said, hey, here's what I do. This is what a coaching session looks like. And we were able to develop an insurance policy that would cover what I needed as far as liability is concerned. And that is it. That is our last slide on HIPAA. So I know that was a lot of information. Bottom line is know your code of ethics.
Yes.
Know the generals of HIPAA. Know that you have to have 2 points of security in place. Know your privacy, know your security, that those two are there. and
Your
just,
scope of practice.
yes, be familiar.
Yeah.
Exactly. That's exactly what I was getting ready to say. Be familiar if someone is working with out of their scope of practice,
Yes.
and know situations that might be a conflict of interest as
Yes.
well. Okay, so you
All
guys
right.
know where we are. If you have any questions around this, let us know. If you are an insurance person and have more information to add, let me
Yeah.
know. That would be amazing. And yeah, so that does it for this one. And we will see you in the next episode.